Hi everyone. This week we're going to be looking at problem-based learning. In recent years, this has become one of the really fundamental ways of teaching and providing assessment across healthcare education, and it often forms the basis of our class discussions. So it serves not only to increase a student's knowledge on a subject, but also build really important skills like diplomacy and empathy, and also the ability to have a professional and constructive argument. So problem-based learning itself is a huge topic that I certainly can't cover all in 1 week with you, but I would recommend you go and do some more reading and consider the use of this method when you're assessing your students in a clinical setting. All patients come to us with some kind of history, and the history is that basic information that we're then going to use to decide how we approach the management of that patient. The history is different for every patient, despite many of them presenting with very similar or even the same overarching conditions. So, for example, a huge number of our patients will present to us with diabetes, but the reasons for them developing diabetes are many and complex. For one patient, it might be to do with obesity, another age, another genetics. So this means that our students need to carry out largely the same investigations for every patient they see, but they then need to tailor them to the answers or the information that the patient gives. So this itself is an example of problem-based learning. The problem is that the patient has diabetes, and the learning is, why do they have it? Can those factors be changed? How do those factors influence the management of that patient and their diabetes? In its true sense, problem-based learning would involve giving a group of students their problem at the start of the semester or the period of time that you're working with them. And then from there, they would be given very little in the way of traditional teaching. Rather than you telling them about the problem, they would be sent away to investigate that problem on their own. And you could give them specific tasks to help break down the problem. So you might ask them to investigate incidents, etiology, presentation, interventions, that type of thing. And you might point them in the direction of some resources. But ultimately, there would be very little input from the educators. As a form of assessment, it's really powerful because this is an assessment for learning, not simply of learning. By completing the task that forms the assessment, the students learn about the topic, and the learning will be at a much deeper level. The students are really forced to become much more engaged with the material rather than the sort of simple rote learning that is often what you see when we use more traditional assessment methods, which simply take place after the learning has happened.